So, good morning, everyone, and welcome to London. I would say it's really a great pleasure, even for me, being over here, and I can see a lot of new faces as well, and of course, a lot of eminent people over here attending the conference. So the topic which I'm going to talk, it's something really close to my heart, definitely, being a cardiologist. And why I'm going to talk about this is what has been happening, I would say, especially in the last few years since the advent of ChatGPT, Gemini, and whatnot things, there has been a lot of interest for that. And we start, I don't know why this slide keeps moving to the forward. There has been a lot of interest, even in the cardiology. Can we do something in cardiology as well? So, of course, doctors are smart brains. They are okay. And we already heard from Professor Weiss, like so many nice things can be done. So similarly, even in artificial intelligence in cardiology, especially arrhythmias, we have been doing a lot of work. So these are my disclosures, and this is what I'm trying to focus upon today. These are my topics, which I'll try to deal with. And finally, of course, we'll try to wrap it up as well. So what about artificial intelligence in cardiology? Is it something new development? Yes, it is a bit new, as we all know. The computer has been affecting everything. I don't know why it keeps going, on its own to the front slides. So I'll try to go like this. So indeed, what has been happening is way back, like in 50s and 60s, that was the first time some work was happening towards the automation. A lot of people were trying to look out like, can something being done to help even in the field of medicine? And of course, cardiology was just, I would say, one of the infants and new babies in those days. Not much was known for the cardiology. And since when we talk like today, in September 2025, a lot of advance has been done. This is my mentor, Dr. Karl Timmermans in Maastricht. I'll show you some interesting figures as well. So we were doing the procedure, one of the ablation procedures, if you can see, there are pulmonary veins, cryo balloon we are doing. We were having a discussion, can we predict using the computer model about the success rate or even about the failure rate as well, maybe, just by looking at the ECG? Is it possible? That was an interesting question where he asked me to work upon it. Okay, I went through, tried to have a look and all. So finally, I was lucky, I would say, to sit with an Italian engineer. He was a brilliant mind. He did his PhD from France. And we could sit together and we could do a few things as well. Okay, trying to sort out the brains together. Finally, does anyone remember this gentleman? Wellens sign on ECG. Anyone has heard? He's Professor Hein Wellens. The Wellens sign on ECG is the one. He's the one. He's also known as the father of modern cardiac electrophysiology. So if anyone would have been in arrhythmia, especially EP, most of the work you will be coming across, he is one of the ones. Bless his soul. He died just a few years ago. And a lot of research has been happening as well. Like, what about the P wave? We all know the P wave is the one which shows the atrial activity. Interestingly, there are different P wave components, and the different P wave components show the different segments of the atrium as well. In fact, just excuse me. So what has been happening? That there are initial segment, a middle segment, and also the terminal segment of the P wave. So as you may see it over here as well, the research has been showing the middle segment of the P wave is due to the myocardial sleeves in the atrium. In fact, the terminal portion is represented due to the sleeves in the pulmonary vein region. So indeed, a lot of research has been happening, which is able to show if one ablates the atrial fibrillation, it will also affect the P wave, and one can determine. And that's what we try to do. In the meantime, when I was trying to do that during my PhD studies, I also tried to explore what about the imaging parameters. any of those echocardiogram parameters like the left atrial dysynchrony, if one may recall about the resynchronization devices like the CRT, the ICDs and all, a lot of research had been happening. Unfortunately, when I tried to look in detail, I saw like, no, unfortunately, one can't predict it. What about some mathematical models? Anyone from the background of mathematics? I'm sorry, this is sounds a little bit tough. So this is what is called as the Gaussian theory. Gaussian theory is like, in the P wave, you are trying to match according to the area. So there's a complex mathematical forms. I must confess, I chose medicine because I was not so good in the mathematics, but what to do? For the research, we all have to touch over there. And this is what we were able to see. And finally, we tried to apply it in the form of automation as well for the P wave analysis. We felt that, yes, we were able to apply it. And in fact, the success rate was also there. So what we did was we did some group analysis as well. We tried to see how was the changes. Oop, what is this happening? Is it okay? Oh, this is the reason we can't, we should not depend upon machines. You saw earlier as well, there was some disappointment now as well. They will be surprising. So when we saw that, we also noticed that there's definitely a P-wave duration shortening. In fact, when we tried to do further analysis, especially in the hybrid atrial fibrillation population, we saw for the persistent atrial fibrillation, which no one would like to touch. Oh, very difficult, less success rate. No, no, no. You know, you can't do much. There as well, we were able to see that there is a good role for that. In fact, yeah, that's one of the problems. Like in this form, the videos playing will be difficult. Okay, never mind. So what had been happening is, even with this, all this data, we tried to show the world that, yes, look, even way before the chat GPT and all these things, there is a big role for all these smart mathematics and even artificial intelligence, so-called. So in the earlier decades as well, what has been happening is, what was one of the first applications of AI? Can anyone guess? As simple as ECG. Of course, because everyone would like to make a diagnosis, and believe me, the work which I'm doing since almost like 20 years now, and as a board certified professional with almost I will be touching 100 publications as well. There is a lot of data available. Often there will be some or the other point of the ECG diagnosis which will be missed even by the qualified cardiologists. It happens. We all are humans. We can't diagnose or see everything as well. And this is why we need to sometimes depend upon the machines, in fact, and to help increase the accuracy. And this is the other reason after ECG, the imaging has been happening. And I will show some of the other slides as well. Okay. Why doesn't it go to the next slide? Okay. Right. Any guesses what type of AI technologies are being used in in cardiology right now? Anyone? So what has been happening is there are multiple roles, like machine-based algorithms are there. In fact, a lot of deep learning has also been happening, truly, like the computer models which you are seeing as well. Several simulations are also happening as well in this field. In fact, there's also a big application which is happening right now about natural language. We'll try to explore some of them as and when we go. So regarding the cardiovascular disease mortality, and I think this is the reason why this conference is also happening, because we do know, even at this moment, there is a significant number of deaths which is preventable, which especially if we can diagnose them at early stages, definitely those people can be helped. And AI, that's where it comes, not just to help in the diagnosis, treatment, and also for the easy follow-up as well, to also to help the overburdened healthcare professionals. So there are three terms: AI, artificial intelligence, machine learning, and deep learning as well. So they do sound pretty similar, but they are not so similar. And why is that? AI actually is a little bit similar to the human intelligence, okay? And but it differs from the human intelligence in the terms of the computational analysis, on which it is dependent. And that's the in our day-to-day life. I don't have any financial interests into these companies like ChatGPT or Gemini, Cloud is there. A lot of, you name it nowadays, like so many companies are there everywhere. And what about the machine learning? So machine learning actually tends to learn from the data without explicit programming what has been happening. There are several examples as well. There are a lot of programs which is there in our day-to-day life which is happening. In fact, then comes the deep learning. Deep learning is the one which tends to use the neural networks, especially for the complex tasks. I will show you some examples as well. In fact, when we are speaking, a lot of developments is really happening at a fast pace. In the last few years, the development has been really happening in a very big way. Indeed, as I said it, the evolution started around early 50s with the role in ECG interpretation, because ECG machines, even right now, what is happening, it is one of the most commonly used tools. But when it comes to its interpretation, unfortunately, a lot more is desired. Then neural networks, especially in the imaging, was explored. It is already happening as well. In fact, now a lot of aims or the work is happening about the integration for that. So right now, as well, as we can see in this beautiful pie chart, most of the work has been happening in the ECG imaging and some of the work for also predictive analysis. A lot of work is also happening in the interventions. I'll show you some examples as well. So considering all these things, what will be its future? So the future definitely looks pretty exciting. And I really think, especially in the coming decade, many more applications will be seen as well. For example, just an echo will be put up, the probe will be done, and there will be an automated analysis which will be there in front of you. And I always say to everyone, don't close your eyes and blindly depend upon any of these. The way in which is said as for the OpenAI software or platform as well, I would like to say the same things even for most of these platforms. Kindly, please don't blindly depend upon that. However, having said that, definitely most of the platforms which is becoming right now getting developed, they are really becoming more and more accurate. And in fact, they're also contributing to our day-to-day life. I would say in one word, if I can say, they will be part of our life. They are there to help us, but don't close your eyes and depend upon it. So one of the first things, cardiac imaging. What about cardiac imaging? I think you all use echocardiograms. There are other tools as well, like the MRIs, CT scan, which we all have to do. Echocardiography was the branch, I would say, like more than a decade ago, when I was doing my training at one of the world's largest pediatric surgical center. It used to be more of a personal dependent, interpersonal variation used to be a lot. So someone would say an echocardiogram, oh, look, there's a left ventricular ejection fraction is like 30 to 40%. Someone else would say, no. I think it's like 50 to 60%. So that is where the role comes of devices like this, the AI. It is going to help with that. And the accuracy will also be there quite a lot for this. Similarly, even in the cardiac MRI. Cardiac MRI is also one tool you would have already heard about, the big role of the telemedicine, people sitting with their laptop in home or enjoying in Bahamas or some fancy places, and they'll be talking, oh yeah, look, I can see this is what it is, the report and all. That is one of the beauty about the AI and also the other applications. In fact, not only can one comment accurately, I would say, about the ventricular function, the myocardial scarring, but also even predict what could be the, how it may change in the future as well. So that's also another very important factor. Having said that, what about cardiac CT? Cardiac CT is one of the commonly used investigations, especially in the United Kingdom, if you were to speak. Even it is available at most of the district hospitals. So, yeah, But when we try to compare it with countries like Germany, I'm aware like Germany has more than almost 5 times the MRI centers compared to UK. So that itself shows that how much can be the scope for these kind of solutions. And even in cardiac, the CT as well, the rule is becoming better, not only to, for example, I wrote a meta-analysis about the CT-FFR, so fractional flow reserve regarding its usage. A lot of work has been happening into that specialty as well. A lot of work about the automation and also the non-invasive assessment, because that's what we all are interested in. Yes, invasiveness, one has to choose as a last resort, but if it can be done in a non-invasive way, for example, with the CT-FFR or the coronary lesions, the progression, how can they be becoming bad or affecting the patient as well? That would be quite a lot helpful. The other field is nuclear cardiology. So nuclear cardiology, the problem has been is the experts are less. The problem has been happening is definitely the advantages are significant. So that is where and young brains are coming to this field as well, but not so much. So definitely automation is a big solution for that. And not just what has been happening, for example, perfusion image analysis. It was again quite a lot dependent upon the people who are interpreting it. And then they were trying for a solution which can be applied to decrease the interpersonal variability. And that is where comes the role of perfusion imaging accuracy as well. In fact, it has been quite a lot in depth and also been able to give futuristic analysis and in depth as well for that. About the ECG, as I said it, that was just an example, which we did it like 2013, 12, almost we were doing it. So way before all these LLMs and all. So right now, as and when we speak, a lot of already algorithms are there which are able to interpret the ECGs as well with high accuracy. Not just able to, they are able to predict about the left ventricular hypertrophy, about the prediction or the chances of some arrhythmias as well. In fact, they may also detect some of the complex conditions. I'm talking like amyloidosis, or even sometimes conditions like, the left ventricular hypertrophy or the NCM and all diagnosis, in fact. How many people right now are using smartwatches? Okay, few hands. Indeed, this is what is happening. Even I do wear a smartwatch, okay? Is it FDA approved? Okay, now this is where the problem happens. What happens is everyone is nowadays using the smartwatches, no doubt. Did you know? I wrote about this paper when I was at London School of Economics doing my master's, actually, policy with cardiovascular outcomes. It was a joint program with European Society of Cardiology. So only a few days back, in fact, just last week only, the FDA approved the first ever device to detect or to measure the blood pressure. Before that, none of the devices has been approved. So a lot of devices will be showing this is your blood pressure, this is your blood pressure, but none. And you know why? This is how it is. So, for example, with due respect to everyone, anyone, even who's walking on the road, they can also check anyone's blood pressure. But will it be medically accurate? Most likely not. And that is where it comes. So if a medically trained professional who tends to check the blood pressure, chances will be more accurate. And till few weeks back, one of the leading technologies was from Huawei, which was almost knocking on the doors of FDA to get its approval because it was based on a puff-based insufflation pad-based technology. I don't want to criticize the US FDA. I've dealt with them several times. So what had happened is this was a little bit surprising. And to make it even more surprising and more insightful, American Heart Association published their hypertension guidelines, management guidelines, just last month. And it has not said, it has said none of the smartwatches are good enough to diagnose hypertension. And there are several ifs and buts. If you look at the FDA booklet as well, which they have given to Apple. Anyways, the CEO of Apple was there, who was gifting a lot of big gifts to the US government. Maybe, never know. Okay, having said that, similarly, another insight I would like to say, none of these smartwatches are approved to estimate the blood sugar levels. Can you imagine? So because what happens is the PPG, what it tends to use, sometimes there can be hair, can be there, sometimes can be sweat as well. There were some companies, I know Apple was very close, has been very close. Google had been very close as well, especially a lot of people who are all are dark-skinned. When the rays tend to go, a lot of it can be absorbed by the melanin, which can cause further errors. This is the reason why, till date, none of them has been approved as well. So a lot of times, even if someone says, your uncle or someone and all says, oh, my watch is showing my blood sugar to be this, please don't trust that. Okay. And other thing is CCG, continuous glucose monitor. So that is accurate. You know why? Because the the continuous glucose monitor, the work will be getting done somewhere else. It is just displaying the values. So that's fine. So even for that, there is a big role, how to make it accurate. How about the diurnal variation, the blood sugar spikes and all. And even in interventional cardiology as well, to make the flow chart much better, to analyze the angiograms, what about the, the real-time imaging of the plaques, the IVUS, the OCT, to predict about the complexity and also the outcome of the lesion. A lot of application has been happening. In fact, not just it enhances the visualization, but also the spatial orientation as well. In fact, a lot of new developments has been happening about the usage of robotics, remote interventions as well. So I know in electrophysiology, in my subspecialty, several robots systems are there. Hansen and a lot of other companies are also trying to see into that. So with those things, with the role of AI, what may really happen, that maybe sometimes in the future, in coming decade, you just tell that I want the pulmonary vein isolation of the left upper pulmonary vein. Click the button, it may be done. But we are far away from that. It might happen. So even in the electrophysiology as well, not just to help for the mapping, for the ablation target, and also to improve the procedural success. Several algorithms are being designed, several softwares are also being planned. Not just the disease treatment, but even for the post-procedural management as well, to predict the complications. In fact, also about the follow-up strategies as well. They are coming and giving a lot of insightful data. So preventive cardiology, I think prevention is better than cure in any subspecialty as well. So even over here, there is a lot of great role, I would say, for the risk prediction, because a lot of data has been coming up in a day-to-day life as well. And to able to personalize the lifestyle and also the medication plans as well, there is a big role for that. In the heart failure, right now, the COVID-19 pandemic already got over. We know that a lot of those COVID-19 pandemic patients, if someone would have had infections, they have a higher risk of development of heart failure as well. And indeed, something like AI again has a big role, not just to help detect the preclinical heart failure way before the clinical symptoms are there. So not just for that, even to diagnose and to help identify the novel phenotypes, on which a lot of work has been happening as well. The wearing devices. I do recall several years back, there was a fitness band, which was just with your fitness band, you can even predict the heart failure, the left ventricular ejection fraction as well. So it had been, a lot of work has been happening even in this field as well. And as you know, like several molecules for the first time got approved just in one decade. Not just SGLT2 inhibitors, the AR-RNA inhibitors, and all GLP-1 antagonists and all. So today, when we are discussing about such a topic, challenges are there, but also are the opportunities. So what can we do? In terms of data privacy, algorithms, personalization. There are multiple steps where we can think of, but definitely we can take care of those problems, and we can help not just in the field of remote care, but also global approach as well. And I think this is how the solution will be looking out. Right now, there are already several solutions as well. So there are some algorithms which can help in the early detection of atrial fibrillation. Alive core devices and all are there as well. Some apps are there as well. Even EchoMD has been there, which has been quite a lot helpful to, for the ejection fraction, pretty expert level accuracy detection as well. In fact, in just a matter of like 30 seconds up to less than 30 minutes, it is very accurate. Not just that, even from Mayo, there was a Mayo AI ECG platform, which has been able to improve the detection of the asymptomatic LV dysfunction. Can you imagine? So before the onset of any heart failure symptoms and all, way before that, just by looking at the ECG, you are able to detect. And in fact, not just it helps in the early detection, but also for the management. Earlier, if someone knows that, okay, this problem may happen, one will be a little bit more cautious, and one will also be taking care of it. In fact, the telemetry. Earlier, during my specialty training, I worked at world's largest telemedicine department. Can you imagine that hospital had a satellite for its own in the whole world, only for telemedicine? So I was trained in India, and we had a satellite just for that. And we were connected to remote hospitals, remote centers in Africa, in Afghanistan, Pakistan, and some centers also in Indonesia as well, where we used to get those patients. ECGs, does the patient need thrombolysis? How can we treat those patients and all? And as I said, world's largest telemedicine. So even in telemetry as well, there has been a big role which has been happening, not only to reduce the false alarms. As I said, it happens. First of all, non-cardiac physicians, they get stressed out. Oh, chest pain. Oh my God, just call the cardiologist, let them take care. Why should we be taking the headache and all? Even for the emergency response. Can you imagine its application? So for example, in US, especially those big countries I'm talking, like maybe China, India as well, when there are those remote EMTs, emergency medical technicians, who will be there in the far off areas with more confidence that, look, there's no acute coronary syndrome, so nothing to be worried about. It's fine and can be managed in the periphery. So definitely it will also be able to help with the false alarm fatigue. So in fact, there are plenty of challenges which are there, like the data quality and also the heterogeneity as well. Of course, there are some ethical concerns and the integration into the clinical softwares and all. But this is where we all are trying to focus right now upon. And there are several algorithms which is available, but they tend to be like a bit like black box. So when you try to ask the company people, like, how does it work? This is a unique algorithm. We can't share, confidentiality. Like, what? Seriously. And yes, data bias is there. And unfortunately, even in 21st century, there is lack of diversity in that data as well. And what about its interoperability issues? And so there are a lot of problems. And of course, the big one, that's why I raised one of my questions to the esteemed professor who gave nice talk about his product, the regulatory considerations. They are trying as well, they are struggling, but it is being tried to establish the AI tools to help the AI healthcare, and also in terms of efficacy and also the safety wise as well. So having said that, the future definitely looks exciting. There is a big role how they are getting into our day-to-day life, especially in the field of cardiology, not just in terms of different parameters, but how are they measured, how are they being taken care of, the integration of data sources into our clinical decision-making for the transparency and also the continuous learning. In fact, a lot of precision medicine work has been happening to personalize the strategy on the basis of genetics, imaging, and also to include more and more data set. Because more data set is included, more will be the chances for accuracy as well. So no doubt, I think in coming days, I think things will definitely improve, where people will be getting benefited from the early detection and also the prevention strategies as well. Because still, whatever may be happening, yes, we are thinking of making colonies in Mars, but still, prevention is better than cure. And especially the clinical research support are making a lot of research, drugs and all has been happening as well. So to summarize, indeed, artificial intelligence is here to stay. We will all have to get used to it. And I would also say, try to use it as a second brain. Try to take, like as your helpful agent. And it is there to help us, okay? And we need to collaborate. And we need to also, at the same time, be more clear about our ethical, clinical, and also the challenges which is there. And I'm sure with all these things, we can help not just the science to grow, but also the field of medicine and cardiology as well to grow. Thank you so much. If there are any further questions, I'll be more than happy to answer.